Hello, my name is Chinanipem Hereta Udihirwa. I am a Nigerian Red Cross volunteer, and this video showcases my final project for GS 497 professional project at Brigham Young University, Idaho. The project is titled Red Cross Community Health Education Toolkit Supporting Safe, Healthy, and Prepared Communities. In this video, I will explain the purpose, process, and results of my project and briefly showcase all project artifacts. The purpose of this project was to create a structured and user-friendly health education toolkit that Red Cross volunteers can use during Red Cross community outreach activities. From my volunteer experience, I identified a need for simple, consistent, and culturally appropriate health messages that can easily be delivered to communities. This toolkit focuses on preventive health, disease reduction, and emergency preparedness. The toolkit is designed for community outreach sessions, volunteer training, health awareness campaigns, and disaster preparedness activity. The project began with an approved project proposal in week one that I submitted, and it was approved, which guided all my development activities. I selected 5 priority health topics based on community relevance. One, personal hygiene. Second, safe drinking water. Third, malaria prevention. Fourth, maternal and child health. And the last one, disaster preparedness and first aid awareness. Each topic was developed into a model with a lesson guide, a participant handout, a digital flyer, and a short video script. I also created a facilitator guide, monitoring and evaluation tools, concept and feedback forms, and an implementation plan to ensure ethical delivery and sustainability. I'll go ahead and showcase this artifact. Here you could see the table of content. This shows you where to find each of these materials in this toolkit. And these are how to use this toolkit. You can read the lesson guide for facilitators and also the things I mentioned about the flyers and the handouts and also community engagement principles. Please, it is noted that all volunteers using this toolkit should respect local cultures, beliefs, and languages and promote dignity, inclusion, and participation. Please go through this toolkit. It will help you in your community outreach. The first module, personal hygiene. The key message there is that good hygiene helps prevent common diseases and keeps families healthy. The lesson guide, the lesson for you as a facilitator can take 8 to 12 minutes. Here it has each step on what to say, how to react when questions are thrown at you, and things to demonstrate. You have step 1, step 2, and the rest of it. And also this, you have a digital flyer for you to print and share as you continue your lesson. Here it has some of the principles you have already talked about for them to wash their hands properly, protect their family, and the rest of it. Here is also a handout for a simple hygiene practices. This also has some of the practices that you have already taught these people. They can go home with this particular handout. It can help them remember what you have said as a facilitator. And the second and the last one for each module is also a short awareness video. I created a short awareness video using Loom. Once you click on this link, it is going to take you to the video and you can play it with this audience. This will help them also understand and retain what you are also teaching them. And then you have the second one, safe drinking water. Here is also a lesson guide for it. Follow each steps. It will help you engage and also impact the community you are teaching. Here also it has a digital flyer. Water is life. This you can print and share out to this audience, for your audience. This will also help them remember what you are teaching. And then you have also the safe drinking water handout that you can also share to these people. This digital flyer and the handout helps the audience you are teaching retain whatever lesson you've taught them. It helps them remember even when they're at home and wherever they find themselves. And here is also a short video. Once you click here, you can view the short awareness video. It is quite nice for you to watch. It contains little information about what you are teaching. This will also help you as a facilitator draw attention of the audience you are also teaching. And the third one is malaria prevention. You have the lesson guide. This will only take you 10 to 15 minutes. It has each step on what to say and what to do and what questions you could ask as you continue. And here is also your digital flyer you can also share to this audience. This digital flyer contains demonstrations of all the things you have taught them. And then you also have the handouts. You can also share this too. This handout also explains what you have taught. It contains the demonstration, it contains the practical, what they could see, what they could see in their environment, and what they could taught. So this handout is something you can share to these people, and they will also implement what you have taught. And it also contains a short video. This video is created in Loom. It can also help in your lesson. It can also help you draw attention. And then you have the module 4. Also the lesson guide, which will take you 10 to 15 minutes. Follow each step. You have an engaged audience, an audience who understands what you are teaching. Each steps helps you, including the flyer when you share it out, it also draws attention and helps them understand what you're teaching. And then we have also the handouts. The handout contains the lessons, the important practices that you've asked them to do, simple and eye-catchy that can help them understand and remember. And then you have the awareness video. Click on it, it will take you to that place. And you play the video, the audience, it also brings their idea, their mind to what you are teaching. And then you have the disaster preparedness and first aid awareness. Also, we have the lesson guide, which will take you 10 to 15 minutes. Follow each steps, and you have a wonderful outreach. You have an audience that is engaged in what you are teaching, an audience that understand, and an audience ready to implement what you have taught. And then you also have the flyer, which I created here. Be ready, save lives. It contains some of the first aid things they need at home, the numbers they could reach out to. And then this handout also contains basic practices that you've already taught as a facilitator. When they go home with it, this will also help them understand. And then the short awareness video that was created that could also help draw their attention. And then you have your indicators where you go out after your lessons to check how much you've imparted and if there are places you could improve. And also for us that created a toolkit where we can improve to make the lessons better for you. And then you have the places you could ask some questions. These sessions are the pilot test feedback form where we get to know how much or how better this toolkit helped you in your outreach lessons. And then we have the ethical consideration, which we want you to understand that participating is voluntary, respect privacy and volunteer, confidentiality, avoid forcing anyone to speak. These things, when you read through it, it will help you understand what you are teaching and also help you as a volunteer and also help us that prepare the toolkits to help you better or prepare or improve these lessons. And then this is my personal reflection of why I developed this toolkit. This toolkit was developed with input from Red Cross volunteer and community members whose experiences and insight contributed to making this resource practical and community focused. I so much love this toolkit that was created. It's also one of the ways I show my commitment to the things I do, to my commitment to my community service and public health education. The Red Cross Community Health Education Toolkit provides practical and adaptable resources that can strengthen health awareness and preparedness in communities. Thank you for reviewing my project.